Good morning. I am Dr. Subhashish Biswas, working as a senior consultant physician at AM Medical Center, Southern Avenue. Today I am going to discuss metabolic syndrome. So what is metabolic syndrome? It has also other names like syndrome X, insulin resistance syndrome, cardiometabolic syndrome. Why it is important? Because it has 5 characteristic features like waist circumference obesity, high fasting blood sugar, high blood pressure, low good cholesterol, that is HDL cholesterol, and high LDL triglyceride. So out of these 5 characteristic features, if 3 are present, then we stamp it as metabolic syndrome. So why it is important? Because metabolic syndrome leads to increased risk of stroke, type 2 diabetes mellitus, and cardiovascular disease. So what is the reason behind it? It is mainly due to insulin resistance, as our cells are not responding properly to insulin. Gradually the cells becomes insulin resistance and obesity develops. Then there is a vicious cycle. Obesity, it leads to high blood pressure, it leads to deranged lipid profile and other factors. So how it is diagnosed? First, diagnosis is done by its clinical features, like we check the waist circumference. For male, it should be below 40 inches. If it is more than 40 inches, then it goes in favor of metabolic syndrome. In females, it should be less than 35 inch. And if fasting triglyceride higher than 150 milligram per deciliter, if fasting blood sugar is more than 100 milligram per deciliter, and blood pressure is more than 130 by 85, then we call it metabolic syndrome. Now, how we diagnose it? We go for this waist circumference, the fasting insulin level. If it is more than 160 picomole per liter, then insulin resistance is positive significance of insulin resistance. And we see other metabolic profile or the lipid profiles are there. Now, what are the associated factors? Associated factors are like PCOD in female, is polycystic ovarian disease, then hyperuricemia, non-alcoholic fatty liver disease, all obstructive sleep apnea, all are these associated factors for metabolic syndrome. Now, what is the reason of developing metabolic syndrome? This is all our bad habits like excessive sweet consumption, alcohol consumption, low exercise level, and sedentary lifestyle. All this can cause metabolic syndrome. So how to manage it? Then we have to go for exercise, regular exercise. We have to reduce obesity, and all this metabolic profile like lipids, they will be controlled by medicine, sugar will be controlled by medicine, blood pressure should be controlled by medicine. If this can be done, then we can treat well the metabolic syndrome.